The state recently changed insurance plans for more than 800,000 people enrolled in MassHealth. Officials say they want to improve the state's Medicaid program and control costs. To explain what that means for consumers is the Director of Health Access and Wellness Service for the Boston Public Health Commission, Beth Baker. Thank you very much for being with us, Beth.
Thanks for having me, Chris.
First of all, anything have you heard about how this is going over with people so far?
Sure, yeah. For some residents who we've helped, it's really been seamless and it's a really straightforward process. I think for folks and families who see multiple providers, so it's not just the primary care provider, they have maybe multiple specialists, or maybe they go and they see a physical therapist or behavioral health services. I think it can be a little bit more challenging to navigate and finding out which plan is it that I can stay in or be in and be able to see all of those providers. And in some cases, people have to make tough choices. In some cases, someone may have to say, in order to stay with my primary care provider, I can no longer see the specialist who I see, or in some cases people want to stay with their specialist and they have more flexibility with their primary care provider. So that's why we're here to help, because it is confusing and no one can be an expert in it. So the Boston Public Health Commission is here to help residents navigate that process.
Now, what's also going on here is a shift away from the old fee-for-service model to managed outcomes, including wellness. So what does that mean for consumers?
Yeah, for consumers, the ACO, or the Accountable Care Organization, it's more coordinated care. So instead of seeing a bunch of different providers at different locations who are all, you're getting those single services with your physical therapist, and then with maybe your psychologist, and then with your primary care provider, and they're all not talking to each other. With the Accountable Care Organization, the idea is that all of these providers are talking to each other and really trying to deliver the best possible care for you, so that it's more integrated and it's not these one-offs with different providers, and maybe they don't know, one provider doesn't know what prescriptions you're getting from the other provider, and just having more comprehensive health care is the hope. So.
Now, I know that's the general strategy, but is there much to pick from out there? Is one network maybe stronger in some things than others? Do they have different incentives in the mix?
Yeah, so across all of the plans, across all of the accountable care organizations, the core benefits are going to be the same. So people shouldn't worry like, oh gosh, if I choose one, I'm not going to be able to go to the doctor for sick visits, or if I choose one, I won't be able to get prescriptions. Those core benefits are going to be the same across all of the different programs, but different plans have different incentives or different programming for their patients or their consumer base. So they might have cooking classes, or they might offer free helmets for kids. So there are those sort of like little cells that all the plans have, and that can vary across the plans. But consumers shouldn't worry like between two plans, well, what if I go with one, I won't be able to see any doctors, or I won't be able to see doctors near where I live. Those will be the same across all the plans.
I do have to ask you about prescriptions, because this is not about just covering the cost of medications, it's about where you can pick them up too, right?
Yeah, so you'll, similar to now, there are networks. So just with your commercial health insurance that you might have through work, or like the commercial health insurance that I have through my job, there are certain pharmacies that you can go to. There are certain doctors that you can go to. Sometimes you need referrals. So the new ACOs will be really modeled after plans that, the commercial health insurance plans that are available to many of us.
Now, I imagine right now, some people, might say, well, I still have the same primary care doctor, but a week later they go out to fill a prescription and they say, oh, we can't do that here for you anymore. People are, they're going to be really dislocated. So what's the first thing they should do?
Yeah, so it depends. For some people, I'm sure people can call MassHealth and navigate through customer service, and customer service is ready and able to answer those types of questions about like where you can go to get services. People can also call organizations like the Boston Public Health Commission, any of the navigator organizations throughout the state, or CAC organizations, and we can help guide people and figure out which plan, first of all, identify, okay, which plan are you in? Because sometimes people don't know, right? The change has happened and they just weren't aware that the change happened. And then based on the plan that they're in, where is it that they can go to get services, including pharmacy benefits?
Well, people can try to get into another plan, but there is a deadline, so we need to tell them about that.
Yeah, so that's really important. So again, similar to commercial health insurance, there's something called a plan selection period, which is the same thing as open enrollment. And during the plan selection period, you can switch in and out of plans as often as you want. I wouldn't suggest that, but you could do it. But then at the end of May, so May 31st is the end of the plan selection period, and at that point, you're locked into your plan. So after May 31st, it's called the fixed enrollment period, and you'll have to wait until next year to enroll in a new plan. So it's really important for people, if someone knows that they're on MassHealth, they have MassHealth for their health coverage, that they look now to find out, are all of my providers in the plan that I have? Can I go and get the services that I want to get with the plan that I have? And our concern at the commission is that for some folks, they may not go to the doctor until July, right? If you're someone who's healthy, you might go to the doctor once a year. And come July, when they go to the doctor, it's then that they'll find out, they'll try to make the appointment, and their doctor's office will say, well, no, we don't take the health insurance that you have, the version of MassHealth that you have. So we just want people to take action now and to just check with their providers, make sure that their providers are accepting the MassHealth coverage that the consumer has. Yeah.
And I guess one other comforting piece of news is, at least for the next couple of years, the government in Washington is still going to be supporting community health centers. I think there was a lot of anxiety about that here locally. Yeah,
and Boston, and Massachusetts as a whole, but Boston especially just has a great network of community health centers, and they provide excellent care. And people can also call if someone is a patient at a community health center, they can certainly call the community health center and make sure that they're enrolled in the type of MassHealth coverage that the community health center accepts.
And the city also has a mayor's health line people should know about as well, right?
Yes, yeah. So the mayor's health line, we are the health and social service referral line for the city of Boston. We help people apply for and enroll in health insurance through the Health Connector and also through MassHealth. We help people navigate this whole ACO change, accountable care organization change, and we can help people make sure that they're in a plan that best suits their needs and the needs of their families. We're open 9 to 5, Monday through Friday, and we have staff who speak 6 languages, so we can really meet the needs of a lot of different folks. And if someone on the staff doesn't speak a language of a resident, we have access to a language line as well.
Thank you very much for being with us.
Thank you so much.
Beth Baker from the Boston Public Health Commission.